And I came out of medical school with the impression that if I memorized everything and knew everything, or as much as possible, as close to everything as possible, that it would immunize me against making mistakes. And it worked for a while, until I met Mrs. Drucker. I was a resident at a teaching hospital here in Toronto when Mrs. Drucker was brought to the emergency department at the hospital where I was working. At the time, I was assigned to the cardiology service on the cardiology rotation, and it was my job when the emergency staff called for a cardiology consult to see that patient in emerge and to report back to my attending. And I saw Mrs. Drucker, and she was breathless, and when I listened to her, she was making a wheezy sound, and when I listened to her chest with a stethoscope, I could hear crackly sounds on both sides that told me that she was in congestive heart failure. This is a condition in which the heart fails, and instead of being able to pump all the blood forward, some of the blood backs up into the lungs fill up with blood, and that's why you have shortness of breath. And that wasn't a difficult diagnosis to make. I made it. And I set to work treating her. I gave her aspirin, I gave her medications to relieve the strain on her heart, I gave her medications that we call diuretics, water pills, to get her to pee out the excess fluid. And over the course of the next hour and a half or two, she started to feel better. And I felt really good. And that's when I made my first mistake. I sent her home. Actually, I made two more mistakes. I sent her home without speaking to my attending. I didn't pick up the phone and do what I was supposed to do, which is to call my attending and run the story by him so he would have a chance to see her for himself. And he knew her. He would have been able to furnish additional information about her. Maybe I did it for a good reason, you know. Maybe I didn't want to be a high-maintenance resident. Maybe I wanted to be so successful and so able to take responsibility that I would do so, and I would be able to take care of my attending's patients without even having to contact him. The second mistake that I made was worse. In sending her home, I disregarded a little voice deep down inside that was trying to tell me, Goldman, not a good idea. Don't do this. In fact, so lacking in confidence was I that I actually asked the nurse who was looking after Mrs. Drucker, do you think it's okay if she goes home? And the nurse thought about it and said, very matter-of-factly, yeah, I think she'll do okay. I can remember that like it was yesterday. And so I signed the discharge papers, and an ambulance came, paramedics came to take her home. And I went back to my work on the wards. All the rest of that day, that afternoon, I had this kind of gnawing feeling inside my stomach. But I carried on with my work, and at the end of the day, I packed up to leave the hospital and walked to the parking lot to take my car and drive home, when I did something that I don't usually do. I walked through the emergency department on my way home. And it was there that another nurse, not the nurse who was looking after Mrs. Drucker before, but another nurse said three words to me that are the three words that most emergency physicians I know dread. Others in medicine dread them as well, but there's something particular about emergency medicine because we see patients so fleetingly. The three words are, do you remember? Do you remember that patient you sent home? The other nurse asked matter-of-factly. Well, she's back, in just that tone of voice. Well, she was back all right. She was back in near death. About an hour after she had arrived home, after I'd sent her home, she collapsed. And her family called 911, and the paramedics brought her back to the emergency department, where she had a blood pressure of 50, which is in severe shock. And she was barely breathing, and she was blue. And the emerge staff pulled out all the stops. They gave her medications to raise her blood pressure. They put her on a ventilator. And you know, I was shocked and shaken to the core. And I went through this roller coaster because after they stabilized her, she went to the intensive care unit, and I hoped against hope that she would recover. And over the next 2 or 3 days, it was clear that she was never going to wake up. She had irreversible brain damage. And the family gathered, and over the course of the next 8 or 9 days, they resigned themselves to what was happening. At about the 9-day mark, they let her go. Mrs. Drucker, a wife, a mother, and a grandmother. They say you never forget the names of those who die, and that was my first time to be acquainted with that. Over the next few weeks, I beat myself up, and I experienced for the first time the unhealthy shame that exists in our culture of medicine, where I felt alone, isolated, not feeling the healthy kind of shame that you feel, because you can't talk about it with your colleagues. You know, that healthy kind when you betray a secret that a best friend made you promise never to reveal, and you get busted, and then your best friend confronts you, and you have terrible discussions, but at the end of it all, that sick feeling guides you, and you say, you know, I'll never make that mistake again, and you make amends, and you never make that mistake again. That's the kind of shame that is a teacher. The unhealthy shame I'm talking about is the one that makes you so sick inside. It is the one that says, not that what you did was bad, but that you were bad. And it was what I was feeling. And, you know, it wasn't because of my attending. He was a doll. He talked to the family, and I'm quite sure he smoothed things over and made sure that I didn't get sued. And I kept asking myself these questions. Why didn't I ask my attending? Why did I send her home? And then at my worst moments, why did I make such a stupid mistake? And why did I go into medicine? Slowly but surely, it lifted. I began to feel a bit better. And you know, on a cloudy day, there was a crack in the clouds, and the sun started to come out, and I wondered, you know, maybe I could feel better again. And I made myself a bargain, you know, that if only I redoubled my efforts to be perfect, and never make another mistake again, please make the voices stop. And they did.